Okay, so now let's talk about the contraception, guys. Now let's talk about the contraception. Okay, contraception. You might have studied this in your obs-gynae classes as well. So the contraception, basically here we are actually having two methods. One is a temporary method and other one is a permanent method, right? So basically here you can see that these are the methods of contraception. Okay, so what are the methods of contraception over here? One, we might be having the temporary method and we might be having the permanent method. In the permanent method, if you talk about the males, then there could be the vasectomy, that is the sterilization purpose, right? And for the females, there could be the tubectomy. For the females, there could be the tubectomy, right? So this is a tubal occlusion. And temporary methods, we are having several methods over here. For an example, we are having the barrier methods, right? We are having the natural methods of contraception. We are having the intrauterine methods, intrauterine contraceptive devices, right? We will be talking about the copper T's and all. And you might be having the steroidal contraceptions over there, right? So we will be actually talking about the detail of these kind of methods, right? So basically, we'll be talking about the contraceptive methods over here, right? So temporary and the permanent. So now I'm just taking the very first one, that is the over here. Let me talk about the natural contraception first of all. So firstly, we are taking the natural contraception, right? So natural contraception. Okay, so in the natural contraception, basically we are talking about some methods over here. Okay, and they are not very safe methods to use over here, but still we should know about them, right? So over here, first method which I'm gonna tell you over here, that is the first method over here, that will be abstinence, right? So first method over here, that will be the abstinence. Okay, so what is abstinence over here, guys? Abstinence means basically what is happening in the abstinence. Abstinence means that there is absence of the sexual intercourse, right? You're not doing the sexual intercourse, there is avoidance of the sexual intercourse, right? Simply that is called as avoidance of sexual intercourse, right? Sexual intercourse, that is your what? That is your abstinence, simply. Yeah, right. We are using abstinence word very commonly for the drugs also. It can be the drug abstinence, right? And in this case, we are using the abstinence if there is no contraception at all, right? Okay, fine. So no intercourse, that is the abstinence. Second one, that is B over here. That will be the what is the calendar method or the rhythm method. So let me talk about the rhythm method, rhythm or calendar method. Okay, rhythm method or calendar method, right? In the rhythm or calendar method, we are talking about basically, the female will be deciding that, okay, at this point of time, she's having the ovulation in her menstrual cycle, right? So she will be marking that period. So obviously, we know that at the period of ovulation, this is called as the unsafe period, right? So if the couple will be having the intercourse at this period of time, at this point of time, so obviously they might be getting pregnant, right? They might be getting the pregnancy over there. So obviously they will be avoiding the intercourse at this point of time, nearby about the ovulation. Usually we are saying that +3 days before the ovulation and 3 days after the ovulation, that is the unsafe period, right? So in the first 10 days of the menstrual cycle and in the last 10 days of the menstrual cycle, they could be having the sexual intercourse and they might be actually saved from the pregnancies, but obviously they might be having the pregnancies, right? But the most unsafe period is of avoiding the pregnancy, or most unsafe period for get away from the pregnancy, that is the ovulation period. So in this point of time, the couples who are actually wanting the child or the pregnancy, then they might be having the sexual intercourse near the ovulation time, right? Okay, so calendar method, that it is the avoidance of the sexual intercourse, right, nearby the ovulatory period, or you can say in the unsafe period, near the unsafe period. Now what will be the unsafe period, guys, over here? Unsafe period, I mean the ovulation period, that is the day 14. I mean before the day 14 and after the day 14, right? So you can say that 3 days before the ovulation and 3 days after the ovulation, right? So please be very clear with that. I mean the ovulation period is the unsafe period, especially for that couple who wants the contraception, right? We are talking about the natural methods of contraception over here. So two methods, abstinence and this is the calendar or rhythm method. One method is there, that is the withdrawal method, right? Withdrawal method. In the withdrawal method, so basically in the withdrawal method, what can be observed over here, that the removal of the penis just before the ejaculation during the sexual intercourse. So removal of the penis just before the ejaculation, right? Obviously during intercourse. So next method of contraception is cycle of beads or Tirumala method, right? In this method, what we are doing basically, this is for but here is a caution over here, or here is a disclaimer for this particular method. We are talking about the natural methods only. The disclaimer is, first of all, that it is used for those kind of women who are not literate, right? And the poverty areas, right, where the literacy rate is poor, or the villages where the literacy rate is not there, literacy rate is not good, or for the uneducated women basically, or the uneducated females, right? Second thing over here is it should not be used, or it can't be used for the irregular cycles, right? For the shorter cycles or for the longer cycles. That is also the rule over here. So it should be used between the 26 to 31 days cycle, right? On an average, we are saying that 28 days on an average, we are saying that this is the normal period of menstrual cycle. So it should not, it could not be used for the shorter menstrual cycles and the longer menstrual cycles. So it should actually be used for the 26 to 31 days of the menstrual cycle, right? So basically we are saying that it should be used, right? So it should be used for regular cycles, first thing, right? Second thing over here is that it should not be used for shorter or the longer menstrual cycles, right? So in this cycle of beads, basically we are talking about this particular this kind of strings are there, this kind of beads are there on the strings, right? And basically what we are seeing over here, in this case we are seeing that there is a movable rubber over the rings over there, right? And as the menstrual cycle is actually going on in the month, right, they will be actually moving this movable ring over these kind of beads, right? So this is the thing. So white bead over here, this is the unsafe period. This is considered as the unsafe period, because over here you are seeing that this is a white color. Okay, so here this is the ovulatory period, probably. Okay, this is the ovulatory period where if the woman will be having the intercourse at this point of time, she might be getting pregnant over here. So this is the unsafe period. Otherwise, the period before the ovulatory phase, that is this period. So this is the brown beads, right? So in the brown beads, the pregnancy is very unlikely. So here at this point of time in the menstrual cycle, they might be having the intercourse over there to avoid the pregnancy, right? So this is a method of contraception for those people who are not much educated, right? Okay guys, now next method which we shall talk about over here, that is the fifth one, right? Okay, or I might say that this is a sign. Basically there is a basal body temperature. Usually basal body temperature is basically there is a rise in temperature just before the ovulation, right? We know that ovulation is the unsafe period for the pregnancy, right? It means the woman might be having pregnancy over there if they will be having the intercourse. So basal body temperature, according to this, basically there is a rise in temperature. How much rise? About 0.5 to 0.8 degrees Celsius. There is a rise in temperature just before the ovulation, guys, just before the ovulation. So during this time they should not be having the intercourse if they want to avoid the pregnancy. But obviously this is not very practical, right? So they will not be knowing about this particular fluctuation, right? So it's very hard. So then next fact over here, that is the lactational amenorrhea. Now you know that what is lactational amenorrhea. It means usually after the pregnancy there is a physiological phenomena from the body side that they are not having the menses, they are not having the menstrual cycle over there, so there is no bleeding, obviously, right? But obviously during that period, if the couple will be having the intercourse, there is no guarantee that they will not be having the pregnancy, right? Because many kind of fluctuations might be there in the body, but usually there are the chances that pregnancy is unlikely in this particular phase. That's why we are saying that this is the lactational amenorrhea. Here, if they might ask you contraception of choice, if they are asking you contraception of choice over here, right? Because they had asked once. So contraception of choice over here is the progesterone only pills, or POP. There is a progesterone only pills, right? Okay. Fine. Now next method over here which we shall talk about, that is Billings method. This is also called as cervical mucus thinning method. Cervical mucus thinning method. Now, during the time of ovulation or nearby the time of ovulation, the cervical mucus becomes very thin, right? And before the period of ovulation and after the period of ovulation, I mean before day 11 and after day 18, right? Probably. At this point of time, the cervical mucus will be thick. So at that point of time, if the couple is having intercourse, probably they will not be having the pregnancy, and if they will be having the intercourse at the point of this phase, that is the cervical mucus thinning phase, so probably the sperms might be having the facilitation of the entry into the cervix and then into the uterus, right? So that might be risky for the couple for having the pregnancy, right? So over here basically the point is, if the cervical mucus is thin at that point of time, is called as the unsafe period, because the ovulation might be happening at that point of time in the menstrual cycle, right? So over here this is the method. So this is the Billings method because it was discovered by the Billings, right? Okay, so I hope you are clear with that, what is the Billings method. So basically in this method we are talking about the cervical mucus thinning over here, and mainly it is happening during the which period, that is the ovulatory period, right? So this is very specific method for fertility. So it is very specific for fertility, because at this point of time, if a couple will be having the intercourse, then obviously that is the time where the chances of having the pregnancy is very likely. Okay, right. Okay guys, then we have talked about the several natural methods over here. Okay, and one more method is there. Sometimes they might ask you, that is the I shall write it as H, that is a symptothermal method. What is a symptothermal method? If you are adding, or if you are combining, basically if you are combining the basal body temperature method with any other natural method, then it becomes the symptothermal method, right? So it becomes symptothermal method. I mean, you are actually combining the basal body temperature with any natural method or cervical thinning method. Okay, this is called as a symptothermal method. Okay, just remember that, it's very easy, right? Okay, now we shall move on to the barrier methods. So first one we have talked about, that was a natural method. This is the second one, this is the barrier methods. Now if we talk about the barrier methods, you know that very commonly we are talking about the condoms, right? These are the main important first line barriers we shall talk about, right? So there are two types of condoms. Males are using the male condoms, females are using the female condoms, right? Not using, but at least we are having the male and female condoms, which should be used actually. If I talk about, then male condoms are much better than the female condoms, right? So over here, let me just combine it. This is the picture where you can, you must be familiar with that already. So this is the male condom over here, and this is the female condom. What's the difference, guys? Over here we can see the only one ring is present in the male condom, right? And over here we are seeing that there are two rings present over there in the female condom. So this is the male condom obviously, and this is the female condom, right? So male condoms are having good capability for restricting the reproductive tract infections and the sexually transmitted infections as well, as compared to the female condoms, right? So over here in the female condom especially, right, one ring will be closed, that is the internal ring, right, and one ring will be open, right, and one ring will be open over here. So this ring over here, this will be open, and this is the external ring, right? So this actually the females will be inserting them into the vagina till the cervix, right? So one ring near the cervix, that will be closed, and one ring that will be open near about the vagina, right? So over there, that's how it is actually protecting the sperm's entry into the cervix. So basically the idea over here is that we want to restrict the entry of sperms into the cervix, right? That is the main idea, because once the sperms will be entering the cervix, they might enter into the uterus, and then probably there might be the pregnancy, right? They might end up with the pregnancy, right? So that is the basic thing of contraception. Basically we are talking about, we want to prevent the pregnancy. How we can prevent it? We are talking about the methods, we have talked about the natural methods, and we are coming to the barrier methods, right? Natural methods, obviously they are not very practical, but barrier methods, if we talk about, they are much practical, right? And they are very helpful in protecting the pregnancies also. So over here we have talked about this thing. Now let me talk about the main difference between the male and the female condoms. right? Okay. So as I said, male condom, it is having only one ring, and in the female condom it is having two rings. I showed you one is external ring and which is actually open, right? And another one is the internal ring that is actually closed. Okay, that's how it is actually protecting the way of sperm's entry into the cervix, right? Okay, the next point over here is that in the male condom it is actually made up of latex, right? And the male condom they are actually available as Nirod under the ministry, under the National Family Planning program. They are actually available as Nirod, right? Under National Family Planning program, right? Under the Government of India, obviously. Okay, and government is actually giving the free supply of the condoms, right, to the household basically, and ASHA is actually providing that. Okay, so once we are clear with that, okay, that's how the Nirod was coming basically. Okay, this was the there was an ad also for the Nirod, right? And this is the packet of the Nirod, and this is the packet you can see over here. Okay, this is the packet of the Nirod, right, where you can see the ASHA Nirod. Nowadays the ASHA is not written over there, I think, on the packet, right? Okay, that is the thing. So that is the Nirod basically. This is the male condom. Now in the female condom, if we talk about, there are three types. One is the FC1, FC2 and FC3. FC1 and FC3, okay, they are not available in India. FC2 is actually available in India, right? So FC2 basically, this condom is actually available in India, right? And this is also coming in the government supply under the under which program basically? Under the NACO program. So under the NACO program already Government of India is providing this again free of cost, right? Okay guys, so once we have talked about this particular thing about the braid method, about the male condom, the female condom, we are having several other methods also, but they are not advised by the Government of India. In the private sector you might find them. Okay, so here these are the first one. Let's talk about, that is the cervical cap, right? Cervical cap. Then there could be the cervical diaphragm. Okay, first let me talk about the cervical cap over here. In the cervical cap we are basically talking about the U-shaped structure caps over there. So these are basically the U-shaped caps, right? These are basically the U-shaped caps over there, and over here they are actually covering the cervix. They are basically covering the cervix. Okay, if you talk about the cervical diaphragm also, they are also basically covering the cervix. They are also covering the cervix. Okay, but they are usually as comparatively they are flatter, right? Comparatively they are flatter as compared to the cervical cap. Comparatively they are flatter in shape. Okay, the cervical diaphragm can also be called as the Dutch cap. Cervical diaphragm can also be called as the Dutch cap. Okay, so they will be inserted again by the female and up to the cervix. Okay, and that's how it will be protecting it, right? Okay, and the third method over here, we might be having one more thing about the cervical diaphragm, guys. It is called as the Dutch cap over here. Basically, they must be removed following the intercourse. They must be removed after the intercourse. That is very, very important. Or at least it must be removed within 24 hours of the intercourse. Otherwise, it is having higher chances. That is a rare kind of side effect, but it is having higher chances of causing the toxic shock syndrome, right? So that is the big problem, big side effect for this one, and that's why they are not very safe, I would say, as far as cervical diaphragm is concerned. So that's why Government of India is also not not suggesting them and not having these kind of methods under their programs as well. So they are having the male condom and the female condom. Male condom is used very commonly, however that is coming at as Nirod, right? Male condom. So that is the thing basically. So cervical diaphragm might cause, so it should be removed. Ideally it should be removed after the intercourse, okay, or at least within 24 hours. Otherwise it may cause this side effect, that is the toxic shock syndrome. Okay, so once they had asked us which kind of side effect might be seen in by the cervical diaphragm, okay, they will make the story in the MCQ that there was a couple and they had the sexual intercourse and all of these things. The female over here in this case, she had used the cervical diaphragm but forgot to remove that. okay, what kind of things might be seen over here, or they will be giving the vitals of the patient, okay, all of these things, and what you need to, they might be asking you the diagnosis, what happened to this particular lady. So answer would be the toxic shock syndrome in that case, right? Once we are clear with that, we might be having one more method over here, that is the vaginal sponge. Third one I'm writing, that is the vaginal sponge, right? Vaginal sponge, actually there is a brand name, very famous brand name, that is a Today, right? So it is coming up with the name of Today, that is the brand name over here, okay? Today is the brand name, okay? And over here we are talking about, it is made up of what? Actually it is containing what? So it is the 1 gram enoxinol 9. So what it is containing? MCQ, 1 gram nanoxinol 9 actually. So this must be known by you. It is called as nanoxinol 9, guys, okay? Fine. Now this is actually having the mushroom kind of shape, right? So this is the mushroom shaped polyurethane, mushroom shaped polyurethane, okay? And this is the disposable sponge, right? This is the disposable sponge, right? Okay, so it is actually used once, and it should be used once, and it is usually most effective for 24 hours. It is usually most effective for 24, right? So that should be remembered by you, right? So basically what is happening with the today's sponge, basically this is a sponge basically, right? It will be actually, it will be having the strip also, right? I will be showing you the diagram as well. This will be inserted by the female up till the cervix. It should be used till, you know, it is having the kind of a mushroom shape. Polyurethane is there, so it is made up of 1 gram nanoxinol 9, okay, that I told you. And over there what is happening, you know, in this particular case, they are having, you know, it is actually preventing the entry of sperms into the cervix, and it is having the spermicidal action, right? It is having the spermicidal action over the surface of the vaginal sponge. I will show you right now, okay? And basically it is actually preventing the entry, so it is acting like a mechanical barrier. So it is acting as it acts as mechanical barrier basically. So it acts as mechanical barrier, which means they will be stopping, or they will be preventing the entry of sperms into the cervix. So they will be containing the spermicidal agents also, right? So they will be disrupting the membrane of sperm actually, and that's how they are preventing the entry of the sperms into the cervix. So that is the thing over here, right? So acts as a mechanical barrier, and they will be contains the spermicidal agents also. So first they are actually preventing the entry, and secondly, if the sperms are actually coming in contact with the surface, then they are actually killing the sperms also, right? Okay, so here what you are seeing right now on your screen, guys, this is the cervical cap. This is the cervical cap over here, right? And that's how it is looking, right? Cervical cap. And over here, what you are seeing over here right now, this is the cervical diaphragm, right? Cervical diaphragm. So this is the cervical diaphragm basically, and we are seeing that how it is applying, right? How they are applying. So this is the cervical diaphragm. You can see this is having this kind of shape, okay? So that is the cervical diaphragm, right? And that's how it will be inserted into the vagina until this is the cervix part over here. So it will be protecting the cervix. So sperms, if they will be coming over here, right? So they will not be allowed to go inside the the cervix basically, right? And then they will not be entering into the uterus. That's how, right? So that's how they are actually talking about this thing, okay? So sperm entry will not be allowed actually. So that's how the cervical diaphragm is actually protecting the entry of the sperms into the cervix. And this is the Today vaginal sponge, right? This is the Today vaginal sponge. So that is the thing over here. It will be having the spermicidal agents over here and having the strip also, so it is easily removed by the female, okay, after the intercourse. And it is effective for how many hours? That is the 24 hours. And it should be removed actually, okay, just after the intercourse. It should be removed actually just after the intercourse, okay, after the intercourse. Otherwise what can happen? I told you already. Otherwise toxic shock syndrome might be happening, okay? That's side effect. You must be remembering that, okay? So once we have talked about, these were the barrier methods actually. Now we shall move on to the intrauterine contraceptive devices, okay? So very important, guys. So this was the Today sponge. We have talked about that as well, right? Now we shall move on to the intrauterine contraceptive devices, okay? Right, intrauterine contraceptive devices, IUCD. Okay, so very frequently they are throwing the questions from this topic as well, contraceptive devices, or some people call them as IUDs, right? Intrauterine devices or intrauterine contraceptive devices, whatever you want to call it, concept will remain same. Over here, look at the classification first of all. So 3 kinds of IUCDs we are having right now. One is the non-medicated IUCD, where we are talking about the Lippes loop. It is looking something like this. Okay, Lippes loop. So this is the Lippes loop over here. I'm showing you the images as well so that you don't have any kind of combination, any kind of confusion, I mean, right? So Lippes loop, basically they are actually inert. They are actually inserted into the female actually. So Lippes loop, they are actually inert basically. Okay, then we are having medicated copper containing IUCD. Obviously you can see the name copper, so they will be having the copper with them, right? And then there is the hormone containing IUCD, which is the Levonorgestrel. Okay, very commonly it is called as a Mirena. Okay, so please remember that, very commonly it is called the Mirena. So non-medicated, actually they are called as the first generation IUCDs, and medicated copper containing, these are called as the second generation IUCDs, and hormone containing, they will be called as the third generation IUCDs. Basically, if we talk about the Levonorgestrel, how much Levonorgestrel we are having over here, actually they are releasing the 20 micrograms per day. Actually the Levonorgestrel, how much they are using, actually 20 microgram per day they are releasing throughout the day. Okay, so LNG20, this is the very common name also we are using for the Mirena, right? How it is looking Mirena, you can see the Mirena over here. This is the Mirena, guys. You can see the packet also. You can see this particular thing looking like copper T structure is there. Okay, but copper means copper is in the name, there is copper. This is not the copper T, obviously this is the Mirena, right? So you can see this kind of structure, T-shaped structure they are having, right? Okay guys, so this is the Mirena. Basically how much Levonorgestrel is present over there, obviously that is the 20 microgram it is releasing per day, okay, in the 24 hours. Okay, so once we are clear with that, 20 microgram per day. So please remember that as well, that might be asked. Okay guys, now then we are having, in the second generation we are talking about, okay, in the third generation progesterone can also be used over there, but nowadays it is not used. Okay guys, in the medicated copper containing IUCD, right, we are having, this is the second generation, we are having copper T, different kinds of copper T. We are having copper T 380A, we are having copper T multi-load 375, then copper T 200, copper T multi-load 250 can be there. Okay, so several kind of copper T might be present over there, and that's how the copper T is actually looking. This is actually in front of you, this is the multi-load 375. This is the multi-load 375, and over here this is the copper T 380A. Very commonly guys, the images they are asking you, right, very commonly. So please remember the images also. This is the multi-load 375. What I can see that copper is actually there, right? Copper is actually there on this particular structure, right? The vertical stem. Copper T, in this particular copper T, we are having the copper. That's why we are calling that as copper. And this is the folded structure. This is the folded structure present on the multi-load 375. This, right? So on the arms there are the spiculations over there. Over the arms there are the spiculations we can see over there. Why the speculations are actually present over the arms over here? Basically these are called as the arms, and this is the stem. So over the arms these spicules are present over there, thorn-like structure present over there. Why is it so? Because with the help of this, there is a good myometrial attachment. Actually we are actually inserting the copper T into the uterus, right, through the cervix into the uterus. So in the uterus, this is the uterus, this is the copper T over here. So in this particular thing, this will be having the arms also. So these arms are having the thorns, these spicules. So they will be having the good myometrial attachment. They will be having the good myometrial. So this is the copper T, this is a multi-load 375. This is the uterus over here, right? This is the uterus over here. So they will be having the good myometrial attachment. That's why that is the role of the this copper T, that is a which one, multi-load 375. Copper T 380A guys, over here we can see these are the arms, basically, right, and this is the stem again guys. So here we can see the copper on the stem as well and on the arms as well. So that's why copper T 380A. A means arms over here, 380 means surface area. Here the 375 millimeter square surface area is there, and here the 380A. So let me just talk about the differences between these two copper T, because they are very important guys, right? Okay, so now let me differentiate between the copper T 380A and copper T 375. But just before that, let me talk about what are the time duration, right? So we need to actually take the consent from the females before inserting these copper Ts, and actually we need to tell them that you are actually safe for this is the safest contraception. Actually they are having their failure rates are very low, basically intrauterine copper devices, right? So basically we are using them for those target couples, and I hope that you remember guys what are the target couples, basically who have completed their families, right? But obviously if the patient is coming to your hospital and having already 2 or 3 childs, so it's not that straight away you will be putting the copper T inside them. It's not like that. Basically, you need to take the proper consent, you need to give proper information to them, what are the pros and cons of the of inserting the copper Ts, which we will be talking about. And then after your job is to make them understand that it is safe to use, and anytime if you are feeling the problem, you can come to us, we can remove also, right? So you need to actually make them counsel. Okay, and if you will be actually working in the obs-gynae department, in the family welfare department basically, and this will be your job, that how to counsel the patient. Okay, this is the basic thing over here, because the in more better way you will be counseling the patient, so they will be having, if they will not be having any kind of fear in their mind, right, then only they will be agreeing to that, right? And against their agreement, you obviously can't insert the copper Ts, right? Okay, obviously they will be getting some kind of incentive from the government as well, but still. Okay guys, so this is the thing, basic thing. So what is the life duration, what is the time duration, what is the lifespan of these copper Ts? Basically, if I talk about the lifespan, over here, right, lifespan for the copper T, lifespan for the copper T 380A, it is the longest one, that is the 10 years. So that is the good one, it is the 10 years, right? If I talk about copper T, that is the 10 years. If I talk about the copper T multi-load 375, okay, and then we are having the Mirena, right? So lifespan for Mirena is around 5 to 7 years, right? And if you talk about multi-load 375, that is around 5 years. Okay, so these are the lifespan over here. Now let me talk about the difference between the copper T 380A and copper T 375 or multi-load 375. Okay, multi-load 375. So what are the differences? Let's talk about them as well. Obviously, first difference over here, which you shall make over here as well, that the copper T 380A, basically it is having the copper in the arms as well, while the multi-load 375, it is not having the copper on the arms. As you can see over here, we can see the arms, they are having the copper over here in the copper T 380A, but in the arms there is no copper in the multi-load 375, right? So that is very basic difference over here, which we shall actually make over here. So we shall write actually, so copper T 380A, basically the copper is present on the arms basically. So copper is present on the arms, right? And here the copper is not present on the arms, right? Second one, we are talking about copper T 380A. So what is 380? 380 is the surface area. So basically the copper is present over there, but what is the surface area? That is the 380 millimeter square. So over here, if you talk about the surface area over here, so A for surface area, A for surface area. So that is basically having the 380 millimeter square, 380 millimeter square. Obviously, what will be the surface area in this multi-load? That will be, as the name suggests, that is 375, right? So that will be the 375 millimeter square. Okay, so this is the area basically. Okay, this is the area, surface area, right? Okay, second thing over here, that when we are inserting this, for example, this is the copper T, this is the copper T 380A. For insertion of this copper T 380A, up till the uterus, I need to actually have the plunger rod. So there is already, the plunger rod is actually coming with it. So, the plunger rod is actually inserted, right? So there is a plunger rod and inserter. So that is present over here. So basically the plunger rod and inserter is needed over here. Plunger rod and inserter is actually needed over here, while there is no plunger rod on the multi-load 375. So no plunger rod over here. Okay. Other main difference over here is that, if you are seeing the copper T, basically it is having which color, guys? Multi-load is having the blue color, bluish green color. Okay, usually it is blue color, and here we are having which color? This is the white color, right? So basically we shall write over here that in the copper T 380A, we are talking about the white color thread is there, and it is usually made up of polyethylene. So there is white polyethylene thread present over there. So white polyethylene thread, right? So white polyethylene thread is present over there, and over here we are talking about the bluish kind of color or the green color can be there as far as thread is concerned over here, and we are seeing that monofilament nylon thread is present over there. Nylon thread, which color, guys? That is the bluish green color. Okay, bluish green color, usually it is blue color, so bluish green color over here. Okay, obviously copper T is having which shape? Copper T is having the T shape, that's why it is T over here. And multilode 375 is having which shape? This is a U shape, right? Okay, U shape. So basically I should not write over here, I should not write the T over here because it is not the T shape, it is the U shape basically. Okay, right. So here also I wrote this one. So this is the copper multilode 375, right? Okay. So once we have talked about that, now we shall move on. So we are actually very clear with the difference between the copper T 380A and the multilode 375, right? Now we have talked about this one. Now how they are actually working to prevent the pregnancy in the patients, right? So let me talk about the mechanism of action over here as far as intrauterine contraceptive devices are concerned. So what is the mechanism of action for the intrauterine devices? Mechanism of action is, basically it is actually inhibiting the fertilization. It is inhibiting the fertilization through some kind of biochemical changes in the cervical mucus, right? Through basically some kind of biochemical changes in the cervical mucus, and basically it is making the cervical mucus thick in nature, so that there is no entry of sperms, or there is very less entry of, or there is no entry of sperms basically into that area, right? Cervical mucus. Okay, and they will be actually inhibiting the sperm motility as well. They will be inhibiting the sperm motility, I mean, inhibiting the sperm motility, okay, the movement, right? Second point over here is that, they are actually inhibiting the implantation also. So they are inhibiting the implantation also. How they are inhibiting the implantation? Because, copper T, basically if we talk about, this is the foreign substance for the body. So via the foreign body reactions, they are actually inhibiting that. So decreasing the implantation via the foreign body reactions, or through the foreign body reactions. Okay, and they are making the cervical mucus thick or thin? Thick in nature. Cervical mucus they are making thick in nature. Okay, so that's how the facilitation of the sperms will be inhibited over there. So these are some of the mechanisms of action. They might be asked very frequently in the MCQs over here. Now, at what point of time we should be inserting the these intrauterine contraceptive device in the female's genital tract, right? So basically we are having different kinds of definitions over there. So times of if we talk about the time of insertion, right? If we talk about the insertion time of IUDs, insertion time of intrauterine contraceptive devices, if we talk about, then we are having different kinds of types over here. For an example, let's say the very first one if I talk about, then we might say postpartum intrauterine. They might ask you what is the postpartum intrauterine contraceptive device insertion. Postpartum means you will say obviously after the birth only, but at what point of time? After how much time? So if you are inserting this just after the delivery of the placenta, there are the stages of the labor, and third stage of labor says that delivery of the placenta, right? You are removing of the placenta. So within 10 minutes of removal of placenta, if you are inserting the copper T, that is called as the postpartum IUCD insertion. So basically I am saying that if you are inserting the IUCD within 10 minutes of placenta delivery, I mean after the third stage of labor, isn't it? Okay. Second one is the basically what is postpartum IUD insertion. Okay, one is the post placental and one is the postpartum. Postpartum means within 10 minutes. Okay, I mean from 10 minutes to the 48 hours. From 10 minutes of normal vaginal delivery to the 48 hours. So over here, I should be writing over here. This was the post placental actually. This is the post placental actually, where I am saying that within 10 minutes of placental delivery. If you talk about the postpartum, in the postpartum we are actually talking about that if we are actually inserting the IUCD after 10 minutes of normal vaginal delivery to the 48 hours of the normal vaginal delivery. But after 48 hours, I will not be inserting the IUCD, and we should not insert the IUCD over there, right? So postpartum IUCD insertion, in the postpartum IUCD insertion, we are actually saying that we are inserting the IUCD from 10 minutes of normal vaginal delivery till 48 hours of normal vaginal delivery. Normal vaginal delivery, right? So this is the case which we are seeing in the postpartum IUCD insertion. Now next one we are having, that is the what is interval, right? What is the interval between the insertion, right? So this is called as the interval insertion. So what is the interval insertion? Interval insertion says that after 6 weeks of normal delivery, if you are putting the IUCD, then this is called as the interval insertion. So after 6 weeks of normal vaginal delivery, right? After 6 weeks of normal vaginal delivery, right? Now next point over here, what is the time of insertion in the IUCD if they are saying that intracaesarean IUCD, very simple. During the C-section only, if you are inserting the IUCD, that is called as this one. So intracaesarean IUCD insertion. Okay, so intracaesarean IUCD insertion, in that case we are saying that intracaesarean IUCD insertion, it means during the C-section only, during the cesarean section, we are inserting the intrauterine contraceptive device, or we are inserting the copper T, right? So during C-section, if we are inserting during C-section, insertion of IUCD, right? If we talk about for normal females, when we should be inserting the IUCD for normal females, right? So for the normal females, if we talk about the best time we are inserting it, that is the first 5 days, right? That is the first 5 days of the menstrual cycle basically, right? So that is the thing over here. So basically can be actually inserted any point of time. So it basically can be inserted any point of time, but basically any time, but you should rule out the pregnancy obviously. So except pregnancy, she should not be pregnant actually, except pregnancy. And what is the best time or ideal time? So best time or ideal time over here will be the first 5 days, right? First 5 days, you can go up to 10 days, but first 5 days are the ideal. This is the best time, or this is the ideal time for inserting the IUCD in the normal female, right? Now if the case is coming like after the abortion, in that case we are saying that best time will be within 12 days of the menstrual cycle. So if next category I will be taking, that is abortion, right? So in the cases of abortion, I shall say that it can be inserted, the best time will be the within 12 days or 15 days. So I will say within 12 days, right? Within first 12 days, that will be the best time for the insertion of the IUCD, right? Now we shall talk about some of the side effects regarding this particular IUCD. So what will be the side effects, guys? So if you talk about the side effects, very commonly they are testing the side effects of IUCDs, right? So we must know them. So side effects over here, they will be very simple to remember. Basically, many of the patient actually, they are coming up with the this kind of problem, like they are actually suffering from acidity or all of these things, but no study actually proves that IUCD insertion is causing the acidity and all of these things. Basically their husbands are they are forcing them to remove the IUCD if they have inserted previously. So most of the females, we are seeing that when we are counseling those kind of females, basically they are actually complaining about the acidities and all. I myself, we have when I used to talk to these kind of females, more than 10 or 15 females I have counseled that they are actually talking about the acidity and they want to remove the IUCD from the genital tracts, right? So this is kind of in some females we don't know. However, the studies are not there, but in some females we don't know, there might be the problem, but there should not be any kind of relation between the acidity and this particular thing, right? So they will be making their own hypothesis to just get rid of this particular IUCD, because they are every time they are thinking psychologically that some foreign body is present inside them or something like that, or in some cases the family is forcing them to remove the IUCD from their genitals, right? So these kind of things are there and we need to counsel the patient accordingly, right? So basically over here, that they will be complaining, the females, most of the females are actually complaining of the pain in the abdomen, and pain in the abdomen can be there, but acidity reasons and all of these things, and due to that they are actually removing. If they are forcing us, then obviously if we will be failing to counsel the patient, right, then in that case we will be removing that. In some cases we are actually sending the patient, okay, if next time I'm just writing the medication, if next time if it comes, then I will remove that, and then I will remove, right? So these kind of things we can actually do with the patient. So side effects, if I talk about, basically the vaginal bleed is the most common side effect. If they're asking you in the question, the vaginal bleed might be there, yes, and that is the most common side effect. If the female is saying that they are having vaginal bleed, then we need to think about it, and we need to think about the removal of the IUCD as well, right? Because obviously, we can't actually give other kind of side effects to the patient just for the stopping of the pregnancy, right? Okay, so vaginal bleed, if that is the case, then it is the most common thing. Abdominal pain is the second most common, guys. Abdominal pain is the second most common side effect for the intrauterine contraceptive devices, right? And pain is the most common reason for the IUCD removal. Pain, basically, as I said, that they are having the pain, this is the most common reason for the IUCD removal. Okay, that they are having the pain regarding the in that area, IUCD removal. Okay, IUCD removal. Fine, right. Along with that, they might be having, some females might be having the pelvic inflammatory diseases, some female might be having the uterine perforation, right? Uterine perforation. However, it is rare only, uterine perforation, but for the exam purpose, we should know that. Okay, some females, they might be having the ectopic pregnancy. However, again, guys, it is rare. Okay, it is not that common we are seeing. So uterine pregnancy also, basically this is caused by the third generation IUCD, that was your Mirena, right? So it is basically, it is seen that it is mostly commonly seen with the third generation IUCD, and that is your Mirena. Remember Mirena, progesterone is not used commonly, but now these days, but the Mirena is there, right? Levonorgestrel 20 micrograms, which was releasing per day, right? Yeah, that one. Okay, now once we have talked about that, let me talk about the contraindications, guys. What are the contraindications? There could be some absolute contraindications for the insertion of contraindications of IUCD. There are some absolute and there are some relative contraindication for IUCD. So we should make sure before inserting the IUCD, before inserting the copper T, we should be taking the proper history of the patient as well, that they should not be having these kind of things, which I'm gonna write over here right now. Okay, so absolute contraindication might be there, or there might be some relative contraindications as well. So what are these contraindications? Let's talk about that as well. So if we talk about the absolute contraindication, guys, if the female is pregnant, if there is a suspected pregnancy, please rule out the pregnancy. As I said earlier as well, please rule out the pregnancy before inserting the IUCD. Otherwise, the present pregnancy might be getting affected. Second point over here is, right, the female should not be having the pelvic inflammatory disease, because that might increase the infection intensity. The female should not be having any kind of unknown etiological vaginal bleed. So unknown vaginal bleed etiology is there. If unknown vaginal bleed is there, we should be preventing ourselves to insert the IUCD in this case, or copper T in this case. If they are having some kind of cancer, for example, cervical carcinoma or breast carcinoma, right, or carcinoma near the genitals or the adnexa, right? So these kind of breast C and all, right, these kind of things will be actually contraindications. These are the absolute contraindications for the insertion of IUCD, right? If you talk about the relative contraindication for the IUCD, then it could be the anemia in the females, right? Then hemorrhage, obviously if they are losing a lot of blood over there, then we will be actually preventing ourselves to insert the contraceptive devices over there, intrauterine contraceptive devices into the genitals, obviously, right? Then if they are having the purulent discharge from the cervix, purulent discharge from the genitals, or purulent discharge from the cervix, then obviously that will be the relative contraindication, right? Absolute means there is no chance of inserting the IUCD, but relative means you should be consulting other doctors as well, right? So there is a relative contraindication, purulent discharge from the cervix, right? In that case, we should not be inserting this, right? Then there is a fibroids. If the female is having fibroids, obviously we should not be inserting this. And then the female, in the copper T, we saw that there were threads present over there. Then if some persons, some females are not very comfortable with that, they don't know that where the thread is and all of these things. In some cases, I have obviously seen these kind of cases. However, they are not very common, that they don't know where the thread is, and we need to find out. So we will be doing the X-ray for these kind of females. Obviously, the pregnancy should be ruled out before the X-ray, because X-ray is contraindicated in the pregnancies. But still, we need to find out in some cases where the copper T is. First of all, we'll be actually looking into the cervical region, looking into the uterus region. But sometimes we are not finding that, then we need to take the help of the X-ray as well, right? So if the unmotivated persons are there, if they are not ready for the follow-ups also, follow-ups are also very important in these kind of cases, right? If the unmotivated persons are there, and the follow-ups, they are not ready for the follow-ups at all, and all of these things, so basically there might be the trouble, right? So in these cases also, we should be not inserting the IUCDs in this case. So if the unmotivated persons are there, unmotivated females are there, who are not very compliable, who are not having very good compliance with these kind of devices, right? So there also we should be not inserting these devices. So unmotivated females and all, they should not be inserted with the IUCDs, right? So that was about the some contraceptives, guys. In the next one I will be talking about the pills. Basically these are the contraceptive pills and all, where I'll be talking about the Mala and Mala D, and what are the injectables which we can use. For example, DMPA, right? Commonly we use the term Dumpa for that, right? What are the Centchroman pills, what is the Saheli, and all of these things we'll be talking about in detail in the next section. So stay tuned, and I will be seeing you in the next one, right? Thank you.